First of all, I just wanted to thank you for joining today. I know everyone's busy and time is of the essence, so I appreciate everyone jumping in and listening to what we have to offer here today. So just to start off with a couple of housekeeping items, just first off, my name is Michael Suits. I'm the downstream marketing manager for our patient monitoring portfolio with remote management, connectivity, and service. So I'll be the one presenting here today, going through all the information and eventually getting into the live product demo for you all. This conversation, so my role is US focused. I know we also have some additional customers on the line from Canada as well, which is awesome. We're happy that you could join us here today. At the end, if you have any additional questions, I would also encourage that you all reach out to your local Baxter representative that would be specific to your region. So if you have any particular questions that are very specific to your hospital or health system, I think that's your best bet. Otherwise, we also have the chat within the webinar here today. So if you have questions as those come up, you can go ahead and type those into the chat. And we also have a couple people monitoring the chat to help answer a few of those. And I'll also get to those at the end of the presentation as well. So we've spotlighted, so I'm coming to you from our Studio Blue center here, which is our recording studio. So we've already spotlighted the screen for you in Teams, and I would also encourage you, at the bottom where it says Skaneateles Remote Selling Center, there's 3 dots, and if you click Fit to Frame, that will give you the best viewing experience through this webinar. And lastly, we'll be recording this presentation, so that will be sent out to you in the coming days that you can also go back and watch more if there was a specific section that you're particularly interested in, or if you have colleagues that weren't able to join, you can feel free to share that recording as well. All right, I think we have a pretty good quorum here to jump in. So first, I just wanted to start off with the assumption that I know all of us have a lot of things going on within our roles, and that through that chaos, we wanted to offer kind of some different insight of how we're helping solve for that. So a few of these areas that I've grouped it into are valuable time being wasted, cybersecurity, and ultimately how essential device data is. So when we look at first with the valuable time being wasted, today with patient monitoring and with your medical devices in general, a lot of your interaction with those devices tends to be very manual, where it's going and touching all the different devices, making sure they have the updates, making sure that they have any of the information is that you need to do, like whether it's preventive maintenance or updates, whatever it may be. So there's a lot of time spent going and finding those devices, going and physically touching them, where what's a better option for that? And then secondly, we have cybersecurity, which is always a very prevalent topic in healthcare technology today and will continue to be very important moving forward. So how are we addressing any of those new threats or vulnerabilities that are constantly emerging? And then lastly, we have the device data and how essential that is and how time consuming it can be to track all of the assets, all the detail that's needed, all the information that you want to really look into. So how can we get that in one place where it makes it more digestible for you? And that's kind of where remote management falls in here. So this is a really important piece when we look at our overall Welch Allyn patient monitoring portfolio with the Connex vital signs monitors. So when we're talking this conversation today, we're focusing on patient monitoring, but one thing I'll say is we also have this capability with remote management for a couple of our other products as well. So when you look at smart beds and the RetinaView 700 diabetic retinopathy camera, those also have remote management available to them as well. So with our Welch Allyn patient monitors, so we have the Connex Vital Signs monitor, the Connex Spot monitor, and the Connex integrated wall system. So those are the specific endpoints that we'll be focusing on today for remote management. And what is remote management when we look at patient monitoring? So what it does is it gives us the ability to access and manage the device service data for your connected vital signs monitors from one central location. And like I mentioned, instead of having to physically go into the advanced settings of each individual patient monitor that you have within your hospital or your health system, this basically compiles this all into one place that you can see it, run reports, be able to perform different service activities in that one specific location. And then also, it gives you access to the up-to-date device details, which would include things like near real-time location. So again, like when I mentioned earlier, having to go physically track down those devices, this can give you near real-time information of where that device is located. So instead of going off and starting where you think it might be, this is the last known location right here. So it gives you a more specific starting point. And you can also do different required software updates and data to help identify needed repairs. So there's a whole host of different activities you can perform through remote management with the Welch Allyn products. And that's what we really wanted to give visibility to and help you manage your day-to-day and hopefully make your lives a little bit easier. So how does this product work? So what this does is it helps you evolve your facility needs quickly. So being able to do that remotely from one location allows you to make those changes a little bit quicker than it would if you had to go plug in a USB into every individual device. And what this does, or what it is it's a secure cloud-based solution. And ultimately it scales to fit your facility's management requirements. And when I say facility, that could also mean your entire healthcare system. So whether you have 20 devices or 5,000 devices or more, this platform gives you the ability to perform a lot of these activities remotely and really helping just improve your overall management of your fleet of devices. And one important note too is that remote management does not interact with patient health information. This is purely looking at device service data and not the patient health information. So these are completely separate pathways for the device service data that's being transmitted versus on the other side of the connectivity conversation is more about the patient information that's going into the EMR. So I just wanted to make sure that there's a very clear delineation of what remote management is actually interacting with. And one theme I wanted to highlight throughout the conversation today is about overall fleet and device management. So when you think about the age of your devices, how well they're performing, any activities that need to be done to service these devices, and whether you're looking to continue to refresh your fleet, buy new, or ultimately extend the life of your devices, this is a great platform to be able to look at that and understand exactly what the health is of those devices and anything that needs to be done to help prolong or improve the overall fleet. So with that, now that you have a little bit of a high-level understanding of what remote management is, I wanted to jump over to our touch screen over here to give you a walkthrough through the demo platform so you can see exactly what it is that we're talking about here with remote management. All right. So as you can see here, this is what the login screen would look like when any user logs into remote management. So in this instance, you can see that we have 3 different locations here. So we have Finger Lakes Hospital, Northeast Regional Hospital, and Urgent Care Center. As far as users go for this platform, we do have role-based access. So if you had just for example, a biomed tech that worked at Northeast Regional Hospital, you could have it so that when they log in, that's the only one they see. Whereas you as a clinical engineer or biomed director or IT director, whatever it may be, and you want to see the entire, all the locations that you have within your organization, there's that option as well. So we do have that way to delineate who can actually access the platform. You can also see, so we've got servers, devices, and beds. In this case, because we're talking about patient monitoring only, I didn't include any beds, but again, know that that's also an option if you do have some of the Baxter beds, the Baxter Smart Beds. So I'm going to click into Finger Lakes Hospital here. And what you'll notice is that down the left side of the screen are 4 different tabs. So then that's really where we're going to operate most of the time here during this demo, but that's how we typically group the different activities that can be performed within remote management. So this first one here was assets. It's the first page that you go into. It's the default. So what you can see is that within Finger Lakes Hospital, here is the list of different assets that are connected in this particular location. So all the different patient monitors that are connected within remote management are found here. So you can see there's different types. So we have the Connect Spot Monitor, the CSM, and the Connect Vital Sign Monitor, the CVSM. Status icons, which we'll get to shortly. Different custom labels that you can go in and create those labels yourself so that you wanted to group them into, like in this instance, we did Med-Surg, ER, different custom labels like that. Firmware version, configuration file, all these different pieces of information that could be valuable for you to look at right at a high level when you first go into remote management. You can also sort these by column here when you tap the top of the column there. This is a demo platform, so a couple of these are fairly outdated as far as when they last connected, but you can sort that. So if you see one that has not connected to remote management in a long time, that might indicate that the device is turned off in a closet somewhere or being repaired or whatever it might be. So it gives you a little bit of a snapshot of those actively connected devices. So this, again, we're going to kind of talk about this on almost like a macro level and a micro level. So macro, you can see from this whole list, like here's all the devices. When we get into the reports function, that'll be also kind of more at a macro level. But one of the things that I think is really interesting is being able to dive very specifically into individual devices at the micro level. So right here, I'm just going to click on this very first CSM, and you can see that it gives you very specific information for this particular device. And this is a snapshot, but you can see asset name, serial number, even firmware, when that was last deployed, when it was last connected, MAC address, IP address, all sorts of very granular information. So today, if you don't have remote management, what your technicians would be doing is going out and physically locating that device, going into the advanced settings, and basically trying to sort through and figure out those different pieces of information, where this gives it to you right there. You can also see that there's a preventative maintenance schedule. So this tells us that the calibration is due in March coming up. So if you have any activities where you know they have to go touch this device anyway for that calibration, this could be an opportunity to help be a little more efficient and plan some of the activities around that as well. And that date gets communicated from the device as the service data to know when that next calibration is due. So then you'll notice that status icon again here in the component information tab, which we'll click into. And again, what this does is just gives you even more kind of granular information. So for this status icon, you can see that it's flagged because of the battery. And we're going to click that. And the reason it's flagged is because the maximum capacity of this battery is only 4%. So that would indicate that it's definitely time to replace that battery, and doing so proactively even before it gets to that low percentage. Anything under 30% is when that icon shows up. So that gives you a good indication that it might be time to replace that battery before it impacts any of the clinical workflow that's occurring on those floors. And some other interesting pieces, it also gives cycle count for the battery. And you'll also see this in a separate report that we'll review here in a few minutes as well. But the cycle count's also interesting just to know the performance of that battery, how heavily it's used, and things like that. So you can also see on here, there's also different, so like the SpO2 sensor, the SureTemp thermometer tells you more information about those probes as well. And again, on the far right, there's the cycle counts to kind of match those components as well. A couple last things here on the specific asset information page here is one of the important things here that I think is really important with remote management is the ability to locate the device. And the way this works is during the process of setting up remote management, you can import basically a map in an Excel spreadsheet of what your different access point locations are. So once you have all those loaded in, this can track which access points is this device communicating with. So that helps us basically triangulate where that device was last seen. So if we hit locate right here, you can see that it tells us what campus it's on, the building, what floor, different things like that. So that gives you the last known location. So basically almost in near real time of when that device was last seen. So again, if you have a biomed tech that needs to run out and grab that device to replace a battery or perform a calibration, that's the first place they should start and know that that's most likely the location, but they can at least get a good starting point for that. All right, so that's kind of the nice detailed dive that you can take into each individual device. And again, by jumping back out to the asset tab, you can go back and look into further devices that you may have specific questions about as well. We're going to next jump into the report section here. So you can see, again, this is the location that we're working in. You can select if you wanted to look at the Connect Spot monitor or the Connect Vital Signs monitor, and then what specific report you wanted to look into. So in this case, we'll take a look at usage quick, but just to give you an idea of here are some of the different variety of reports that are already kind of baked in the system for you. So firmware version, configuration status update, firmware status, activity, CMMS report, etc. So usage. So this shows, this pie chart at the top is just the number of devices on each floor. But once you scroll down, it gives you even more valuable information. And this is where I mentioned earlier with the cycle counts. So when you're looking at the battery or the SureTemp thermometer probes, things like that, this can give you a really good kind of macro look. Instead of being in that individual asset, you have the macro look at all of the different devices within this location and what those cycle counts are looking like. And where you can find this valuable when you think about the overall fleet management is understanding, okay, this particular floor of the hospital, these devices are getting very high use. So what can we do to hopefully balance that out? Maybe swap those with another area of the hospital where it's very low use, or a different clinic altogether. So there's different opportunities that you can take to look at overall usage and how you can improve the overall use and management of the fleet when you think about that long term. So we'll jump over to firmware version, which I think is a very important aspect when you think about this from the cybersecurity side that we mentioned in the beginning. And I know the IT folks on the call will definitely be interested to understand how to really see what firmware versions are out there for all of their connected devices. So in this case, so with the ER, the firmware version we can see is the 1.42, and that there's 5 total devices that have that firmware. And then in MedSurg, they're also on the same version of the firmware, and there's 20 of the devices. So if there were multiple versions out there, so if there was 1.41, 1.40, those would show as additional lines, but it's a good thing that right now these are just the only firmware version that's out there. If there were multiple versions that you could see in a long list, which over time, it tends to just add up a little bit with that version getting slightly out of date as new releases come about. So you would expect to see a handful of different ones, but now with remote management, you can actually address that and get those new firmware versions pushed out, which we'll touch on in a minute. And then I'll jump to firmware status, because I think there's some value in this report for different information. You can see some on the asset page in the beginning where you can see like last connected, the last firmware version deployed, things like that. One of the nice things about most of these reports also is that we have the ability to download or print, things like that. So you could actually manipulate that outside of the remote management platform if you ever needed to create anything on your own as well. So we also have that flexibility, which is nice. Activity, and this is again more of that high level roll up for the overall battery health in particular with this report. There's a couple other things as well, but one of the things that I think is great is having the maximum capacity where you can sort it to the lowest amount, the lowest percent there. So you can see a couple at 4%, and then up to 16%. So that gives you a quick look at, okay, we have 5 devices that could really use a new battery immediately. So how can we address that and go track those down and get those swapped out? And then lastly, I wanted to touch on the CMMS report. And what this allows is that if you are currently working with a CMMS platform, which I'm sure a lot of you are, this gives you the ability from remote management, instead of having to do any sort of manual transcription or copying and pasting of like serial numbers, IP addresses, things like that. This can actually allow you to export to a CSV, which you can then format and import into your CMMS platform. So it really helps with that manual transcription piece of it and just giving you a simple kind of a source of truth coming out of remote management. All right. And then I'm going to jump to the next tab here, which is the updates tab, which is the final one that we'll really dive into. So again, so we have selecting the asset type. In this case, I'm going to select the Connex Vital Signs Monitor, the CVSM. And what this tab is all focused on is the remote pushes that we've talked about. So in this case, the CVSM, we can remotely push a configuration file. Instead of today, again, if you don't have remote management, what you're doing or what your techs are doing is taking a USB stick and going and tracking down every single device within your hospital or system that needs that particular configuration file update, plugging it in, loading the configuration file, doing that update, and moving on to the next, which is a very time-consuming process. So the nice thing about remote management is you can actually do this remotely. So in this case, I'm just going to choose one of these configuration files. So if this was the one that we wanted to send to the different devices, we select that one, click next, and then this gives you the option to select either all of the devices within the list, or if you wanted to choose just the ER, for example. And for those of you that aren't familiar with what a configuration file is within the Welch Allyn patient monitors, is the configuration file basically controls the overall behavior of that device. So if you wanted to have your ER patient monitor perform slightly differently than the MedSurg patient monitor, like with certain modifiers or what's displayed on the screen, the configuration file is what helps drive that behavior. So in this case, let's choose these 4 MedSurg devices. We'll hit next. And then you can see it comes up with an option of pushing this update immediately or doing it on a scheduled basis. So what this means is that if you select immediately, the next time that device calls home, it will receive that configuration file from the server because it's sitting there waiting for the device to call home to then accept that configuration file. Scheduled works very similarly, except it just does it on if you wanted to do it at 8 a.m. or 10 a.m., whatever makes the most sense for your clinicians to understand that we're doing an update. This is when you can expect to see this come through and that change be applied. One very important note on that is these remote pushes will never interrupt any sort of clinical activity that's going on. So if you have a patient hooked up to the monitor, they're taking the blood pressure or the temperature, it would never interrupt that cycle. It would be once that device is idle. So you wouldn't have to worry about that interrupting any sort of clinical function. So in this case, we'll just do immediately here, and we'll hit confirm. And you'll see this message pop up, the update process has been established. So that means that configuration file is getting sent out to sit on the server and wait for the device to call home to accept that. So jumping back to another example here. So the Connect Spot monitor we'll do here. And you'll see that the Connect Spot monitor also has this upgrade option, which is the ability to remotely push any firmware updates. So when you think about cybersecurity, this is where you really see a lot of the benefit and being able to push that firmware update instead of, again, having to go physically touch each device with that USB. So we'll take the 1.52 as the latest version that we want to push out. And because with firmware, I want to push this out to all of the different devices instead of only the specific ones. I'm going to select all of them, hit next. And again, you have that same exact option of the immediately versus schedule. And one thing with the firmware updates for CSM, when you do immediately or schedule, actually with schedule, you can have it automatically power cycle the device to load the firmware, and that the next time it turns on, it'll have that update applied. Some customers prefer the immediately option because what that does is it gives a prompt on the screen. So they might give every clinician a heads up like, hey, you're going to see an update come through on your vital signs monitors. So please accept that update. And then they click it and acknowledge the update to take place. So there's 2 different workflows you can think about, but you have the option of either having it be acknowledged at the monitor or having it automatically cycle and take that update. And we'll just do immediately here. And again, update process has been established. So that really covers a lot of the kind of key functionality with remote management and how you can use that within your healthcare system, and especially just the time savings of being able to push push updates remotely. That could potentially, ideally, save you time. So we're really excited about this offering and definitely want to drive a little more attention to it and how we can really help you within your workflows and make your teams more efficient. There's also all of that detailed device information that we reviewed. So whether it's at the individual level, kind of that micro or the macro with the different reports, there's a lot of different information and ways you can kind of slice what you need to see based on your needs and exactly how you need to look at your data. And then lastly is just that location function. So with the access point mapping, being able to give your techs or yourselves individually a good starting point for where you can go to look for this device, that's a great function that you can really capitalize on. As kind of a last step here, if you have any very specific questions or if you have further interest in talking about this solution for your hospital, your healthcare system, please reach out to your local Baxter representative, and they'll be happy to talk through it and get the right people involved to really understand what the project looks like and how you can really take the next steps with remote management.